Hi, everybody. Welcome to CREP's quarterly webinar series. Today's session is titled Understanding HSA Requirements, Reimbursements. This session is really geared for exercise professionals who want to deepen their understanding of health savings accounts, flexible spending accounts, reimbursements, and how to really better serve their clients. There's going to be four kind of areas that we're going to be talking about today. What are HSAs and FSAs? How do you maximize HSA benefits and FSA benefits? The third one is common challenges and solutions. And then the last one is impact on health fitness professionals and businesses, and how do you prepare as a business? Today's panelists are Amy Bantham and Mike Kaczynski. If you can take a moment, Amy and Mike, if you can introduce yourselves, that'd be awesome.
Sure, Amy, go ahead.
All right, thanks, Mike. I am Dr. Amy Bantham. I am a physical activity researcher. I am a CEO and founder of a company called Move to Live More. And I am the immediate past president of the Physical Activity Alliance, which is the nation's largest coalition of organizations dedicated to promoting health and well-being through movement. Mike, over to you.
Yeah, and I'm Mike Kaczynski. I'm the Vice President of Government Affairs for the Health and Fitness Association, formerly known as IRSA, for those of you who may not be familiar with our new name. I am our government affairs lead and head lobbyist here in Washington, D.C., working to promote and protect the health and fitness industry, everything from yoga studios to big box gyms, and make sure that the industry has a voice before Congress. Like Amy, I also am part of the Physical Activity Alliance and I'm the current incoming chair for the Physical Activity Alliance Policy Committee here in Washington.
And a bit of, before we get started, just a bit of housekeeping. For anybody who has any questions, please put that in the Q&A function. We'll answer your questions at the end. So please, as they come top of mind, please go ahead and ask those questions and we'll answer those at the end. So I guess to get us started, I guess, Amy, would you be able to kind of introduce us? What is a health savings account and what is a flexible spending account, just to kind of give us a kind of a ground level understanding what those things are?
Absolutely. I'm happy to level set. Before I do that, I just wanted to mention one thing. As a fitness professional of almost 30 years, I was thinking about what this audience would most want to know about HSAs and FSAs. But I also want to add the caveat, and Mike, I'd love to hear your thoughts on this as well. We as fitness professionals, we don't need to become experts on HSAs and FSAs. There's so many things that we need to be experts in, behavior change, motivational interviewing, fitness, and technology. We don't really need to become experts. What we do need to know is enough so that we can be in compliance with IRS guidelines, so consumers, our clients can be in compliance, and so that we can use HSAs and FSAs, which I will explain what they are, I promise, use them to build our businesses and to help consumers access our products and services in the most cost-effective and affordable way. So I just wanted to put that out there first. Mike, I don't know if you want to add anything about that specifically.
Yeah, no, I couldn't have said it any better. There's a whole complex system of tax code and different laws that we pay attention to. But at the end of the day, what we want to ensure, and that where you can feel comfortable, is that all the conversations that we're going to have today is really about helping you all continue to build the trust that you need with your clients and your customers in order to make sure that your business is successful and that your customers trust and lean on you for support in their physical activity journeys.
Great. So now to your question, Francis, which I promised I would get to. So HSAs, health savings accounts, FSAs, flexible spending accounts. We'll probably use HSA, FSA from now on because they're a bit of a mouthful, but they are tax-favored accounts that can be used to pay for qualified medical expenses. And they're a little bit different, so I'll talk about the differences between them. HSAs are really more like individual bank accounts, whereas FSAs are more like a benefit plan through an employer. And there's different eligibility for them. For an HSA, an individual needs to have a high deductible health plan and no other major medical coverage. With an FSA, an individual needs to have an employer-sponsored insurance. And so those are sort of the main differences. Sometimes we talk about them interchangeably, but I think there are important differences. I think we'll talk a little bit about the differences when it comes down to compliance and documentation. But those are really the primary ones. And I know we'll get into what's a qualified medical expense. I know we'll get into how do we use these for physical activity expenses like what we offer as fitness professionals.
So it sounded like, Amy, that their comment was on using those HSA and FSA accounts for medical procedures and kind of things of medical necessity. It sounded like there was an IRS change, and the IRS change is now looking at exercise and physical activity. What does that mean? I guess I'll ask that to Mike. Is just like from the federal, or is it a federal law, a federal change, or is it a state change? And kind of, could you walk through that a little bit?
Yeah, absolutely. So it is a IRS code change. It's a guidance that comes out from the Internal Revenue Service on what are qualified expenses under the use of these accounts. And to keep it very high level, back in March of 2023, the IRS released guidance that clearly stated that these accounts could now be used for qualified expenses with a letter of medical necessity. So understanding the important treatment values that come along from physical activity in chronic disease, obesity, diabetes management, and other strength training management from the physical therapy side of things. So the IRS had reclassified those expenses under treatment-oriented services to allow for those expenses to be qualified when they are assessed and prescribed by a medical professional in the care treatment section. Amy, anything I missed there just on the IRS change? It's worth noting that this does not extend into, and I know we'll talk about this a little bit more, into the preventive space, which all of us are working so strongly to try and change to make sure that one day we can work towards having preventative services covered under these accounts as well.
Yeah, nothing that you miss, Mike, just something that helps me think about it a little bit and to try to clarify. And I do think it was a little bit of a clarification of the guidance. Previously, physical activity expenses very squarely in the personal expense or general health expense. And this clarification that with a diagnosis of a disease and with a letter of medical necessity, that physical activity expenses could be eligible paired with that letter of medical necessity. So that really helps me think about it. And when we've talked with the IRS, really this distinction between a general health expense versus a qualified medical expense. And Mike alluded to this, those of us who work in preventative health, we know how important it is to prevent disease and not simply treat disease or treat the progression of disease or even prevent the progression of disease. And so we'll get to fit and what that does, but to move us more squarely toward preventative health is something that we are all working toward. But what we have now is current IRS guidance, which really talks about diagnosis of a specific disease.
But to come full circle and understand for the fitness professional what that means that there may be people looking to have a training regimen built out, handheld, fitness programming developed to help them treat something that was diagnosed by a medical professional where they were told, getting a cardiovascular exercise program in place or a strength training to build lean muscle mass plan in place is where they'll be sending folks to, fitness professionals for that assistance.
Great. So I want to explore that a little bit about those particular reimbursements. And I think what would be helpful for our audience to understand is like what part of their job, I think in my head, it's like a job task analysis. There's sometimes the client assessment, like what level of risk do you have? The design of exercise program is whether the program is effective or efficacious. I think it's another one. And then the last one's how do you report that information back? I think one is just like, what are reimbursable expenses? I think, but I want to pause there for a moment and kind of look at, are these for conditions that are pre-existing? So if I have, like, say, for example, I have obesity and high blood pressure, I was diagnosed with that, I'm already in a fitness program. Can I use my HSA and FSA payments for that? Or is this for something new? So, like, for example, I have pre-diabetes, and then a couple months goes by, I go back to the doctor for my physical. Now I have full-blown diabetes. This is a brand new thing, and now I can use those benefits there. So, before I guess we dive into what's reimbursable, who is it reimbursable for?
Yeah, Amy, do you want to field the clear guidance on the medical necessity part, and then we can dump into how the reimbursement process works a little bit?
Yeah, so my understanding of the process as laid out in the guidance is that a healthcare provider has diagnosed an individual with a specific disease, and they have this licensed provider has written a letter of medical necessity indicating that physical activity is a part of the prescribed course of treatment. The individual then has a receipt documentation, which needs to be the day of the letter of medical necessity moving forward. So it needs to be for a regimen and exercise protocol that day, again, moving forward. And then, Mike, I know you wanted to field the process of reimbursement, but Francis, this is a really important point. We have heard from the IRS that it is a new diagnosis. We have heard from the IRS that the but-for stipulation is very important, that the individual would not incur the expense, the physical activity expense, but for the specific disease. So it means that it needs to be for an activity that was not pursued prior to the diagnosis. So hopefully that timing and that language is helpful. Mike, anything to add to that before we dive into process?
Yeah, no, I think you covered it. There's just understanding that the letter of medical necessity needs to have a clear and concise understanding of what the diagnosis was and why it's necessary, and that the onus lies on the individual to submit that letter of medical necessity to their HSA provider in order for the approval process to begin, before they'll ever seek to work and submit claims or receipts from the process and in the actual performance.
So I guess it's like, if you can walk through the process. I think we kind of talked about a little bit about letter of medical necessity. You need to have a receipt, and et cetera. Can you walk through a little bit about, okay, kind of paint by numbers? It's like, okay, here are the things that you, as your responsibility as exercise professionals, to educate your clients. Like, here's the best way to go about it, like step by step. Could you kind of walk through that? And I'm not sure if that's Mike or Amy, you want to go through that.
Certainly,
Mike.
I can take a crack at it, and then Amy can help me along here. But the first and foremost, as an individual, one of your clients would be, for those on the call, one of your clients would consult with their healthcare provider, and they, who would evaluate the medical condition and determine a specific treatment of activity, right? As in physical therapy, specialized exercise programs, et cetera, and what is necessary. Then they'll produce that letter of medical necessity that clearly details the medical condition, the specific treatment and activity required, and how that treatment will help manage the condition, right? So all of this will be included in the documentation received by the client, who will then take that and go begin the submission process with their HSA or FSA administrator according to the specific procedures. So they'll get there's the option to receive a pre-approval to that, which then they can receive before the treatment starts. Or what they'll do is they'll submit that with the incurred expense. And now the way that HSAs and FSAs typically work is, in many cases, there'll either be a debit card form of payment that can be used to do that. But in many cases, all of those debit card providers or those HSA and FSA providers require documentation in order to reimburse the claim. So the individual will pay for the treatment out of pocket or directly from their HSA and FSA debit card, depending on how the process is set up for them and their individual payers that they have available to them. They'll keep all of the receipts from their programming that was developed by the definition of the medical professional that you all would work to help develop in their treatment process. They'll keep that documentation to ensure that they have it in case they're leaned on, and they'll submit both the letter of medical necessity and the receipts to claim reimbursement for the expense for the physical activity, the personal training, et cetera. And that's typically how it'll work on rotation. If the program is, say, a 6-week physical activity regimen that they would have where the contract is all up front, it could be one contracted receipt cost for the personal training or the physical activity training, or it could be billed on a regular cycle, just like a regular programmatic training regimen would be. Amy, anything there that I missed?
No, the only thing I would add, again, bringing it back to the role of the fitness professional, I think it's really important to think about where we sit and how we can empower consumers to do what they need to do to accomplish all the steps that Mike laid out. So we want to empower them to go and talk to their healthcare provider and to get this prescription of physical activity paired with this letter of medical necessity. We as fitness professionals want to empower consumers to talk with their HR departments about what their benefits are and to understand from them the process by which they need to submit that letter of medical necessity and that itemized receipt. And so again, we as fitness professionals are not doing this for our clients. We are educating them so they know the steps that they need to take and how they can draw upon their healthcare network and their employer network in order to follow through on what's needed in order to purchase at a more affordable price, given the tax-favored account nature of HSAs and FSAs, so they can follow through on that health and fitness journey with us as fitness professionals.
Wonderful. And so I guess with the HSAs and FSAs, because it's a tax benefit, could you walk through I guess if somebody wanted to maximize their use of an HSA and FSA, is there annual maximums? I mean, I think there are folks who are on this call, have an insurance, you have just traditional insurance, and so you don't have an HSA and FSA account, so you may not be aware of it. Are there maximums for either one of those accounts? And there's processes that are going to be a little bit different. So how do you maximize that benefit? And let me throw it to Amy first, and then Mike, if you want to kind of respond.
Yeah, I have to write down the maximums because they change yearly. So I have them here. So individuals in 2024 can contribute up to $4,150 to an HSA, and it's $8,300 for families. So that's the maximum contribution in 2024. The FSA maximum contribution for 2024 is $3,200. These change yearly. There's an additional allowed. There's an extra. Is it an extra $1,000 for those of a certain age, Mike?
Yes, I believe so.
Yeah. And really. Mike, I'm interested in your thoughts on this because this is where fit is so important and where it comes in. Oftentimes, people don't have planned expenses, and so they don't contribute the maximum allowable. And so the ability to know that you have a 6-week, 8-week fitness regimen that you're planning on starting, or that you have planned monthly costs, really allows you to contribute the maximum. With HSAs, you can change your contributions at any time throughout the year. FSAs are a little bit different because of the employer, employee, and the employer-sponsored insurance piece of it. FSAs tend to have open enrollment periods that not exclusively, but primarily are in the fall. And so consumers can talk with, again, the FSA administrator and understand when the open enrollment period is. And if they know that they will have planned expenses for the following year, they can take it up to that maximum allowable contribution. Mike, anything to add on that?
Yeah, I think it's, and you touched on this a little bit earlier, but I think it's just worth reiterating that the difference between an HSA and an FSA account is that, as Amy said, there's caps on what could be submitted to both of them. But with an HSA account, if I had a high deductible plan and I had the access to an HSA, I could put aside $4,000, $125, whatever the number is this year, annually into that account. And at the end of the calendar year, if I did not use that money on qualified expenses, the account rolls over year to year and grows with me as I advance in my career, and I take it into my retirement and then can withdraw and use the money tax-free during my retirement. With an FSA, that is a specific tool in the toolbox in a relationship between an employer and an employee, which allows you to put that maximum set aside amount of, I believe it's $3,050 annually into an account that I need to use for qualified medical expenses by the year end, so by December 31st. And if I don't spend all of the money that's in that account, I lose it. That money goes returned to my employer, who offers me the option of having this tax-free account. So what we see a lot of times with individuals, to Amy's point, is a fear of putting money into these accounts because it's put into the account on an anticipation of an expense. What the great opportunity is in the health and fitness industry and in the entire physical activity community is the ability for us to be able to pre-plan expenses and use these accounts as a tool for people to understand how they can use these accounts effectively. We all know what the cost of our gym membership is per month, per year, and so you can forecast out at the beginning the cost on that. So we're doing a lot of work in that space to try and get to the point where one day these accounts can be used for the general fitness membership, for the general physical training use, for the general relationships and tools that we use in our physical activity regimens. For the professional side of the equation, there's nothing really that you need to worry about. Again, this is a relationship between an individual that would be coming to you to utilize your expertise and utilize your relationship, and the payment and processing side is on their responsibility and their job with their FSA or HSA administrator, the IRS, and their relationships there. I think, as we look to the future, we have a lot of opportunity, but as we look to what's currently allowed, it's worth noting that when you're thinking about billing and receipts, understanding that there is a cap on what may be eligible to be spent if someone is solely coming to you with an FSA and not those HSA accounts that they may have been building year over year. So if the maximum contribution limit is $3,050 per year, that's what someone is putting aside, not only for these incurred medical expenses, but also to use on their prescription drug costs and any other maintenance in the medical realm that they may have in their day-to-day healthcare journey.
So let me ask a question. I'm sorry, Amy, I just cut you off, but does the Physical Activity Alliance or does the Health Fitness Association provide any sort of educational documents for the exercise professionals to go, hey, as a client of mine, did you know that there's some IRS changes that you potentially could use this benefit? Is there any resources that are available that we can tell our exercise professionals, go here, download this document, there's some information you can to teach your clients or educate your clients rather?
Yeah, I'm happy to step in. We're in the process of developing tools both for the facilities that are the operators that are our members, those brick and mortar fitness facilities, but we're also in the process of putting some documentation together so that the fitness professionals understand what their role is, what their responsibility is, and then how they can work through the payment and billing process to make sure that they're providing accurate information for their clients to be able to submit for these claims without fear of of hiccup between the payment and reimbursement process.
Yeah. So first, wearing my Move to Live More hat. So I work with clients, club operators, fitness professionals on developing materials and resources. I don't have anything that is publicly available. Now wearing my Physical Activity Alliance hat, we do have a webinar that we did with the with SHRM, the Society of Human Resource Management, with the IRS, with Physical Activity Alliance, with the National Physical Activity Plan, with Health and Fitness Association. I was mentally going through who was on there. Mike, of course, was on our panel, where we have that as a resource. It's a recording and transcript that is publicly available, and anyone can access that. And that is particularly useful for various scenarios that the IRS went through with specific language and guidance that the IRS provided that is captured again on video and as a written transcript.
Wonderful. I'm going to figure out how to link the YouTube channel to it. I'm like, oh, I figured it out in between while you guys are talking on about that. But I think, Mike, you alluded to it a little bit about the FIT Act, the PHIT Act. And there's a difference between this is a letter of medical necessity, and this is what it is. If for a diagnosis that's new, that you're using exercise and physical activity to address something that's new, the HSA, FSA side, the FIT Act is a little bit different. This is more preventative, right? So could you walk through the FIT Act and what it is?
Yeah. For anyone who hasn't been familiar with it, the FIT Act is a piece of legislation that the Health and Fitness Association and many others in town are looking to support and push through Congress, working with members of Congress to get across the finish line. And what it would do is it would change that IRS code that we talked about earlier to reclassify physical activity, not solely as a hobby or a treatment expense, but also as a preventive healthcare measure. What that would do is by changing that coding would open up the eligibility to use these accounts in HSA and an FSA to pay for physical expenses on the front end. I would be able to use it for my monthly gym membership. I would be able to use it for proactive physical therapy or proactive fitness regimen, the training with a fitness professional. So it really lets me become the CEO of my own health and really use the dollars that I'm putting aside at the beginning of the year to work on prevention rather than solely on treatment and chronic disease management on the back end. So this is something that we're really excited about. We had it introduced back in March of 2023 as well, with more support than ever before. The bill has been around for a long time, but the way that legislation works in Washington, D.C., it takes a long time and a steady drumbeat to build support and finally get it across the finish line. We're closer than ever as of today. We currently have nearly 100 supporters in the House of Representatives and nearly 20 supporters in the U.S. Senate, which is an incredible amount of support. It's clearly bipartisan. And on the committee of jurisdiction that would be responsible for, deciding whether or not this bill moves to the floor for vote, we have a majority of the members on that committee, the House Ways and Means Committee, supporting the bill. I've had some really great conversations recently about opportunities to get the bill moving and across the finish line. And we have the best shot than ever in early 2025 as Congress returns after the election and after the new year. And we'll be focused on sole tax issues. So we have a great momentum, a great wind at our back, and we're doing the work internally to make sure that the support's there to get it across the finish line. Now, what that bill does specifically is opens up for an individual to set aside $1,000 of that FSA or money or HSA money or $2,000 per household to spend on those physical activity expenses or youth sports expenses. So for anybody that has children that play sports, either baseball, basketball, soccer, you would be able to pay for those fees for your child to enroll and play in the sport per season, which we know continue to grow, continue to get more expensive, and continue to make those opportunities a little bit further out of reach for many families in the United States. So having the ability to put money aside at the beginning of the year for your child to play soccer in the spring or the fall is a great opportunity and something that we're certainly excited about, because we know that if we get children moving at a young age, it creates lifelong active individuals.
Yeah, I just two things to add on FIT. One, which is not specific to FIT, but you reminded me, Mike, as you were talking about households and youth sports fees. HSAs and FSAs are very much for not only the account holder for HSAs or FSAs for the employee, they're also for spouses and dependents. And so there is the ability, as when we're thinking about fitness professionals, yes, it's for our clients, and prospective clients, it can also be for family members. And so when we're thinking about growing our businesses, when we're thinking about helping clients achieve their health outcomes and their family members' health outcomes, it's really impactful to think about the benefits for the whole family unit, the whole household. The other thing that I was thinking about, Mike, as you're talking about FIT, is that when this March 2023 guidance clarification came forward, I think there were many of us, as we were reviewing the language and really thinking about it, we were very hopeful that this was moving us more toward preventive health. And when we, again, looked very closely at the language and really got the confirmation that it has to be triggered or prompted by a diagnosis of a condition. And the beauty and the benefit of FIT with changing the definition of a quantified medical expense to include that preventive health piece, it really changes it so that it isn't just sick people with conditions who are able to access these physical activity expenses and to get FSA, HSA reimbursement for them. It's really anyone who's thinking about how to positively impact their health and stay healthy and not enter the healthcare system. And before that, they move into that treatment phase. So I think that's just such an important piece of this. And it's why we as fitness professionals do what we do every day, is to keep people healthy.
Right.
I was going to ask you, Mike, looking at your crystal ball in the impending election, is there a difference the way you would approach the FIT Act depending on the president, or is it just like, look, it doesn't matter the party, this is just improving health outcomes of folks, and it doesn't matter what party you're involved? But I don't know if you could answer that. I know that's a loaded question, but I don't know if there's any way you could answer that, just like, because I know that the folks are sincerely interested now.
Yeah, no, the general concept's the same, right? And I'll preface it by saying nobody has bad things to say about the bill, the prospects of the bill, and what the bill does. I think when I have the luxury of talking with elected officials all the time in settings both professionally and outside through the use of our PAC, sitting down for dinner at a fundraiser, or talking, and I get the benefit of sitting in a room and talking about a piece of legislation that will increase access and increase the ability for Americans to invest in their physical activity for their mental and physical health. And every time I bring it up, whoever's in the room around me becomes immediate supporters, and they do. And that's why we've been able to, grow the support from bipartisan group of legislators. If you look at the bill right now, there's an equal number of Republicans and Democrats supporting the bill. And I think that that's a testament to it being strong, good policy and something that the American people want and need. In terms of how I approach, pushing the bill across the finish line, certainly the dynamics, the parties changing hands, the House maybe shifting to Democrat, the Senate maybe shifting to Republican. Who knows what happens with the White House? There's certainly dynamics there, but at the end of the day, the argument remains the same, that providing individuals this access to be able to take advantage of these tax-free accounts to incentivize physical activity, I think resonates across the board. And it's really about that incentivizing point. You can imagine from the fitness professional perspective, right? As I mentioned, an FSA is use or lose. So if you're thinking internally about, okay, when's busiest time for a health club or a gym or, personal training, typically January, February, March, right? That Q1 of the calendar year. You can see the vision that if if eligibility is changed through passage of the FIT Act, all of a sudden that busy period may move up to Q4 of the year, where individuals realize I have $500 remaining in my FSA account that I will lose on December 31st. Why don't I get a personal training session? Why don't I try and take a different class than I ever tried before? Why don't I, check in with a new studio that's in my neighborhood that I haven't really had the opportunity to check out and experience? So it's a great opportunity for the industry as a whole as well, for the opportunity to bring people in before that January rush, and utilize and market the ability to spend those leftover funds as an opportunity to get healthy before the holiday season.
Great. I'm going to pull us back into the HSA and FSA discussion. I know you all just are the experts in the FIT and then also FSA and HSA side. So I'm going to pull us back a little bit into kind of the business side of kind of preparing for specifically the HSA and FSA component of it. When we're thinking about for the exercise professionals and preparing for these, when we're thinking about from the operations perspective, like what is your advice to organizations and or exercise professionals of like, hey, documentation, et cetera, like what is your advice to individuals who are looking to maximize these benefits for their clients?
In terms of documentation, my advice is empower your clients, all consumers, to do it themselves and talk with their providers, get what they need. They keep the letter of medical necessity. They don't hand it over to you. They keep it. And if it's an FSA administrator, they submit it. You don't see it. If it's an HSA, they keep the documentation in case of an audit. So I would say stay out of the documentation as much as possible. Do you agree, Mike?
Yeah, and I'll go back to just what I reiterated at the beginning of the conversation, that so much of the fitness professional's relationship is about building trust with their client and with the member of the facility or with the person that you're helping get healthy. So at the end of the day, you want to make sure that you keep that trust growing. And again, this is a relationship between the payer community and the individual, and you are providing the service at the end of the day. So be there to listen, be there to understand what their needs are that are being recommended and prescribed through the letter of medical necessity, and then work to perform and treat them in that way. And that's really the service that you need to worry about is the care and the development of programming, just like you all do in your day-to-day lives already. So it's a great opportunity for you to really just be there as a support network for your client community that is coming to you with these new recommendations for treatment and management.
Yeah,
so part of it, what are your thoughts on, so certainly you are an advocate for your clients. It's just like the care and feeding of your clients, not true care and feeding, but it's just like, here you're an advocate for them. It's just like, these are opportunities for you, this, that, and other. Do you think it's an opportunity for you to engage with their healthcare provider? Just like, hey, here's the exercise program that they're involved with, and be able to share kind of like not only the growth, but just kind of like their improving health outcomes. Is that an opportunity then to kind of engage with that group and build trust with the healthcare community? What are your thoughts there?
I have strong thoughts, having spent, I don't know, almost a decade working on this now. It's a wonderful opportunity to open the channels of communication through the client/patient to, one, you're helping the provider understand the benefits of what you're offering. If the provider had concerns about cost for the patient, you're helping to allay those concerns because this is making it more affordable for their patient and your client. And it's a wonderful opportunity to report back through the client, arm them with what they need in order to say, hey, you told me I had this condition. You gave me a letter of medical necessity. I was able to make it more affordable by use of these HSA, FSAs. I'm enjoying it. I've gotten this much stronger. It's really impacted my energy levels, and they can report back. And it really opens those channels of communication, and it builds those trusted collaborative relationships, really positioning fitness professionals as part of that collaborative care team, working hand in hand with providers.
I've also heard of exercise professionals reaching out to the physicians and go, look, we'll give you the services for free. Why don't you try it out and see what the benefit is for you as an individual? And then they would be able to champion for those exercise services. And I guess the next questions, when we're kind of looking at the horizon about here are things that are coming up. I know with the PAA and its and the kind of the HL7 work that we're working on to get exercise as a not a vital sign, as a metric that in electronic medical records, and just being able to go, here's you would benefit from exercise and here's where you'd refer them out to. I guess it's like, are there certain organizations who are better prepared, or this is kind of like, these are the organizations that would benefit most, or they have the appropriate services? Kind of like, what are your thoughts on there? Is just kind of you're looking at the horizon. Exercise is certainly getting added in as part of the opportunity to refer clients out or patients out to kind of health and exercise and physical activity services. Is there any organizations that's better fit to do it, or is it kind of everybody is able to do it?
Yeah, Amy, I don't know if you want to jump in first.
Yeah, Francis, there are a couple acronyms that you use, so I'll just level set a little. So PAA, Physical Activity Alliance, and HL7 is Help Level 7 work that we've been doing as part of our It's Time to Move initiative, which would essentially make physical activity assessment, prescription, and then referral out to a community-based resource like a fitness studio, like a qualified exercise professional. It would make that a standard of care in US healthcare. And so the work we've done is really to establish a process, establish an implementation guide that healthcare systems can use it. And the way I think about it, which I think is really helpful to really show the potential impact. Right now, if a consumer, an individual sees a healthcare provider, those who've seen a healthcare provider in the last 12 months, maybe 1 out of 2, more likely 1 out of 3, were asked about their physical activity levels by their healthcare provider. What the It's Time to Move campaign and initiative hopes to do, and we've put the tools in place, and now we're working on implementation, is really to incorporate that as part of the clinical workflow in every single healthcare system in the United States. So not 1 out of 3 or 1 out of 2, but every single patient would be asked that question as prompted by an electronic health record system that has a field and a standardized measure capturing minutes per day, days per week of aerobic physical activity and days per week of strength training. So the system would prompt the clinician to have the conversation with the patient, and that would start the process by which patients would be referred out to health and fitness professionals. So that's just a little bit of level setting about what we're hoping to do. So who is best positioned for that? Was that the question?
Yeah.
I think fitness professionals who know and understand the importance of building trusted collaborative relationships with healthcare providers, I think is my short answer there.
Yeah, I think everybody has the opportunity to be well prepared for it, as long as they're understanding the parameters of what the responsibilities that come along with it are. And so, as again, I'll keep hitting that trust point. You need to be have a trusted collaborative relationship with your client. There needs to be a trusted collaborative relationship with the medical industry, and frankly, a trusted collaboration between us who are here doing the work at the end of the day, making sure that we're sharing the voice of the industry and sharing the opportunities that are available through the industry. as this continues to progress.
Wonderful. So they got us through our questions, I think, from the top. So now it's our Q&A session. And so there was about 3 questions that came in. And so I'll let you figure out who wants to answer it first. The first one was could you clarify the term prescription and what document would be needed there? This is specifically for the letter of medical necessity and itemized receipts.
Yeah, I'll go ahead and jump in. The letter of medical necessity itself would theoretically be a prescription. It would not be the old-fashioned, right, the way that we do with pharmaceuticals, where it's on a script pad and you have a piece of paper. It would be an actual letter diagnosing the disease, the medical issue that needs treatment, the specifically recommended treatment that is being recommended by the medical provider, and then the individual who is in need of the treatment would then take that letter of medical necessity to receive the programming, receive the treatment that was recommended, and utilize that as their claim and proof of medical need to the HSA or FSA provider.
Would you, I guess, Amy, to be able to put that in the letter, would you use the physical activity guidelines? It's just like the amount of aerobic-based exercise and/or the strengthening, the strength programs that you would use. Just like this person has insert disease or condition. These are generally recommended exercise programs to improve the health outcomes of this patient. Because they're inactive or not active enough, they would use that as the basis of the prescription. At least in my mind, that would be an easy way, because at least you can go, that's a peer-reviewed resource that you could use for the prescription. What are your thoughts on that, Amy?
Yeah, I think that's absolutely appropriate. I have poured over a lot of different letters of medical necessity. Some insurers provide them in terms of templates. Some clinicians have templates for them. Some FSA administrators have templates. There is no specific stipulation that it needs to be on a prescription pad, or that it needs to be a letter even, but it does need to contain certain information. It needs to have the equivalent information that would be on a clinician's letterhead, so name, address, practice, etc. The fact that they're a licensed healthcare provider, that needs to have their signature. As Mike mentioned, it really needs to have the fact that there is a medical diagnosis and physical activity is indicated and necessary to treat that specific disease. And there doesn't need to be a length of time as part of, so I am saying that my patient has hypertension, and in order to treat the hypertension, needs to pursue a 6-week program or an 8-week program. That could be part of it, but it doesn't need to be part of it. But I think an important thing for us to mention is that a letter of medical necessity is valid for 1 year from the date of the letter of medical necessity. So consumers need to be aware that there does need to, it is a 1-year letter of medical necessity, valid for 1 year.
So I guess let me ask this question as a follow-up. So if there's a letter of medical necessity that insert disease, they start the program. At the end of the program, let's say it's been a year or 350 days. If the point was high blood pressure, and because of the exercise program, their high blood pressure goes away, can they continue with that program, or does it end because now the exercise program addressed the issue, it has gone away, and now it's done? I just want to clarify that part of it, because I've heard things, but I just want to put for this audience.
Yeah, and that's where we get into the murky area here, right? Because it is specifically for an evidence-based treatment, prescribed remedy. And so maintenance, and Amy, correct me if I'm wrong, maintenance and preventive is not currently covered under the IRS guidance. So in terms of the treatment itself, the treatment is for the length of the need of the treatment. To Amy's point, with that letter of medical necessity expiring a year from the date of issuance, there would need to be another letter of medical necessity issued at day 366, declaring that there's still treatment needed. So you can see that from the management side of it, where somebody can be brought down on their high blood pressure, their blood pressure can be taken down to a manageable point, and then the maintenance is no longer prescribed, for lack of a better words, through a letter of medical necessity.
That's correct.
If the condition comes back, could that be a new diagnosis, or it's like, hey, you had it before, sorry, we're not doing it again?
Right, and yeah, exactly, and so, Francis, you're touching on the point why it's so important that we continue the advocacy work to get fit across the finish line and make that pass, and get so that from the preventive and the maintenance side, a monthly membership can be paid for, a continuation of a program can be paid for, using these accounts, and that's where the focus is. Like we mentioned earlier, I see the opportunity, this guidance, as opening the door for the conversations, because we now have the ability to understand, and IRS has the ability to understand, the power of physical activity. So it's our opportunity to continue to push the needle and continue to push for passage of FIT, which will ultimately one day make the need for those letters unnecessary. Because at the end of the day, if FIT gets across the finish line, it is characterized, physical activity is characterized in the IRS code as preventive healthcare, just like it is if you wanted to use your FSA or your HSA to purchase an over-the-counter drug, or any other preventive health measures from your local pharmacy or prescriber.
Yeah, Francis, the scenario you outlined is one that we went through with the IRS, and I think we can all agree that the ability to manage hypertension is one of the wonderful powers of exercise. And so what you outlined is a success story. And so we want to continue to support consumers in pursuing what is successfully managing their disease state, and, to Mike's point, and I think we all agree, preventing the onset of hypertension to begin with.
I do want to do one follow-up, and then there's two other questions there are two other questions that are out there. From conversations we've had at HFA, that we've had in the discussions, and I know that there were some discussions with others like Ram Milstrand and others who are in this space, the cautionary tale with the IRS, and I think the allusion to the medical marijuana and how those cards were sent, and then you have the physician, and it's like a churn and burn kind of thing. And it was a cautionary tale of the way the IRS is looking at this. Mike, can you give a really quick synopsis of what that meant? Just because I heard it, but I didn't really quite understand what that meant. And if you can just kind of explore that a little bit, and then we'll try to get the last two questions.
Yeah, and I think, the easiest way to understand it is that the industry ourselves, what we want to do is make sure that the industry is positioned to continue to not only build trust with the client community, but build trust with policymakers. And as we're working to pursue this, we need to continue to rebuild and enhance the reputation of the industry in both directions. I always fall back and need to remind myself that this industry, as a professional, large contributor to economic development in the United States, is very young. It's a 50-year-old industry, 55-year-old industry when it really came on the mark in the early 80s. And there's a lot of reputational issues that we're, as an organization, working to change, and a reputation that we're working to create here with policymakers in Washington, D.C. And I say that because in many eyes of lawmakers, the industry is seen as a business where people are either, for their own personal gains, trying to get bigger or trying to get smaller, depending on what their choices are. And what we're doing is repositioning the understanding that physical activity is essential for the physical, mental, and societal health of every American across the country. And as we're working with that, we're working to combat claims of bad business practices that some have had in the past. That we can tell the stories all day, about not being able to get out of a contract, or the challenges of a long time ago, businesses setting up tables, collecting money, and then never opening the facilities on pre-joins, year-long contracts that were impossible to get out of, et cetera. So my recommendation for fitness professionals as they go about this is at first, do no harm. Again, it's all about building that trust. You are there to, make sure that your clients have what they need to help in their health journey, and that's what you get to provide. In terms of the letters of medical necessities, it's something that is certainly needs to be looked at very cautiously by businesses, and how they want to engage with their members. Because everything in this business, the only way this business survives is with the people that utilize it. And if you're breaking down trust with those people, and you're breaking down trust with policymakers, that's where we just need to make sure we're being very careful moving forward. Amy, do you have anything there?
No, that says it.
I think the two questions about FIT, I think, Mike, you've answered those. I think the questions were, does the FIT Act only allow for reimbursement by the letter of medical necessity, or would the HSAs and FSA debit cards be able to be used? And you already answered those ones. And the second one would be
so the best, moving forward, if we were to get FIT across this finish line, those debit cards that work directly with the HSAs or FSAs, those could be the cards on file with a fitness facility that were charged on a monthly rate up until the maximum spend. Or it could be submitted, your ACH payments, as we know so many facilities are moving to. You would just submit those receipts for reimbursement like you would your prescription drugs at the end of the year.
Great. I
Yeah,
think the second one
no letter of medical necessity
would be necessary. Right.
I think the second question was related to FIT was, would the FIT Act be applicable for preventative health options as well? And I think you clearly answered that one.
Yeah,
So
that's what the FIT Act
purpose.
solely works to do, is to make sure that IRS treatment of the expenses is categorized as preventive health.
So I'm going to give you 1 minute each for this next question, and then your part, because I really like to keep it really tight, because I do want to have any parting advice for you all, for the audience. Have you ever encountered any physicians who do not want to write a letter of medical necessity? And is there any standard template available for that letter?
So I actually have been doing a fair amount of research over the last number of months, talking with healthcare providers about their practices around referring patients to exercise facilities. And what I have heard from them is that they want to help their patients be able to pursue physical activity. And Francis, to your point, meet physical activity guidelines. The number one most important thing to them is getting their inactive and insufficiently active patients more active. Whatever that looks like, moving them along toward meeting the physical activity guidelines. And really what they ask for is, help us, make it easy for us to write these letter of medical necessity. And so providing templates for them is very welcomed.
Wonderful. Parting thoughts. We're in the last 2 minutes of our conversation. This has been so exciting just to kind of hear you all just kind of explaining all of this in a way that's understandable for our audience. So this is great. What is your, I guess, any parting thoughts you have that we haven't covered today? Is just like, you're like, hey, gosh, here's, if you want to know more, here's where you go. But any parting thoughts? And where you go from here?
Yeah, I'll keep it brief. Parting thoughts is that the industry is changing. This is a diverse industry that serves all levels of physical activity, all levels of fitness. It's an exciting chapter for this industry as we move towards the ultimate goal, as Amy talked about, of making sure that one day we get physical activity being able to be assessed, prescribed, referred, and then ultimately the big vision at the end of it all is reimbursed. And the work that we're doing here in Washington and throughout the states to make sure that that not only it's able to be done, but that the industry is prepared to do it is very exciting. So it's exciting to have so many great professionals in the industry, and so many great professionals that are helping everyone understand that value. So my parting thought is just thank you for what you do for your clients, for everyday Americans, for everyone that's working to make sure that they're utilizing physical activity to help promote their physical and mental health.
Wonderful. Amy, any
Yeah,
parting thoughts?
my parting thoughts. Mike and I sit on a lot of panels when we're talking about this, and often we're talking about very sort of dry things, dull things, compliance with IRS guidelines, and we're often saying, can't do this, can't do that, can't do this. It is incredibly important that we do this in compliance with IRS guidelines for all the reasons we've talked about today. But I would echo what Mike's saying. We as fitness professionals, we do what we do because we love helping people pursue their health and fitness journeys. And there is a tremendous opportunity here for more people to access what we provide. Health and fitness programming and services. This is helping to make it more affordable to them. It's helping to establish relationships with healthcare providers so they can send more and more of their inactive and insufficiently active patients to us. So it is a tremendous opportunity to do what we got in this industry to do to help more people along their health and fitness journey. So it's incredibly important timing and topic.
I think my last advice for folks who are on this call and anybody who listens to the recording, get involved. Get involved with your member organization, get involved with Health Fitness Association, get involved, or at least track information that's coming out from the Physical Activity Alliance. These organizations are working together to fight for you as exercise professionals, and get involved and stay current with information that's out there. We're constantly pushing out information for you to stay abreast of what's coming up there and how we're defending and protecting the space. So I think that's probably a wonderful place to stop there. Amy and Mike, great job on the presentation today. This has been exciting. We will send out the recording to all those here who are on who have attended live, and look forward to working on the next webinar. Thank you, friends. Take care.
Well, thank you for having
Thank
us.
you. Bye, Al.
Bye.